Swallow right now, just once. Pay attention to what you feel at the back of your throat. Is there a thickness sitting there? A coating that refuses to clear no matter how many times you cough or clear your throat this morning? That feeling has a reason. And in the next few minutes, you are going to find out exactly what it is. Think about how long this has been going on. If someone asked you to pinpoint the exact day it started, could you? Probably not. It crept in slowly. First, it was only in the mornings. Then it followed you through the whole day. Now it is simply part of your routine. You carry water with you everywhere you go. You have quietly stopped eating certain foods. You have tried whatever remedy a friend, a neighbor, or an article online suggested. And yet here you are still clearing your throat. Here is the part that matters most. That mucus is not random. It is not simply something that happens because you are getting older. Your body does not produce symptoms for no reason. Every persistent symptom is a message, a signal that something specific is happening beneath the surface. The real question is whether you have ever been shown how to read that signal. Today, that changes. This matters because persistent throat mucus is one of the most dismissed symptoms in adults over 55. People are handed lozenges. They are told to drink more water and move on with their day. They are reassured it is just age, and the actual underlying cause sitting quietly and untreated never gets addressed. That stops today. We are going to walk through 5 specific, research-supported causes of persistent throat mucus in adults over 55. And we are going to do something most explanations of this topic skip entirely. We are going to talk about which of these causes tend to show up together, reinforcing one another, and why that combination makes the problem feel so much worse and so much harder to shake than it should. Before we go further, answer this honestly in your own mind, or better yet, write it down in the comments. Is your throat mucus worse first thing in the morning, or does it stay with you all day long? Hold on to that answer. By the end of this, you will understand exactly what it means. Let's start with something almost nobody explains properly, and once you understand it, the rest of this will make complete sense. Your body produces mucus every single day, around the clock, without pause. That is not a malfunction. That is healthy, necessary biology. Mucus is a protective coating for your airways. It traps bacteria, dust, allergens, and viruses before they can travel deeper into your lungs. It keeps the delicate lining of your throat moist, flexible, and resistant to damage. Without it, your airways would dry out, crack, and become an open door for infection. Mucus itself is not the enemy here. The real issue is what happens to that mucus as the body ages. There is a system inside your airways called mucociliary clearance, and understanding it changes everything about how you see this problem. Your airways are lined with millions of microscopic hair-like structures called cilia. Their entire job, performed millions of times a day without you ever noticing, is to sweep mucus upward and outward so it never has the chance to sit and accumulate. In a younger body, this system works fast and efficiently. Mucus is produced and cleared almost as quickly as it forms. But research has confirmed that as we age, these cilia slow their rhythm. They beat less frequently and less powerfully. The result is striking. Mucus that would have been cleared within seconds at age 40 can sit and pool for hours at age 65 or 70. What that means in practical terms is simple but important. Any factor that pushes your body toward producing more mucus is going to hit harder, last longer, and feel more relentless in an older adult than it ever would in a younger one. This is not a flaw. It is physiology. And understanding it is the foundation for everything we are about to cover. So here are the 5 causes. Pay close attention because some of them tend to stack directly on top of each other. And that combination is often what makes people feel like nothing they try is working. The first cause deserves your full attention because research consistently identifies it as the most frequently overlooked explanation for persistent throat mucus in this age group. It is called laryngopharyngeal reflux. You have likely heard of regular heartburn, that burning sensation in the chest after a heavy meal. That is classic acid reflux. But there is a quieter, far more deceptive version of this problem. No burning in the chest, no obvious digestive discomfort at all, just a throat that simply will not settle. Here is what is happening beneath the surface. Where your esophagus meets your stomach, there is a muscular valve whose only job is to stay closed once food has passed through, keeping stomach acid locked safely away. As we age, that valve can gradually lose its tone, much like a rubber band that has been stretched one too many times. When it no longer closes completely, stomach acid begins traveling upward, not just into the esophagus, but all the way into the throat, the voice box, and sometimes even the nasal passages. This is where the biology becomes critical. The tissue lining your throat is not built to tolerate acid the way your esophagus is. Even the smallest trace reaching your throat triggers an immediate protective reaction. Your body floods the area with thick mucus to shield the irritated tissue. It is a completely logical defense response. But when this happens night after night while you sleep, you wake up every single morning to that familiar heaviness in your throat, with no obvious cause and no idea why. There is no chest pain, no burning, nothing pointing toward your stomach. That is exactly why it gets missed. Research published in clinical ENT literature shows that up to half of people dealing with this condition report no heartburn whatsoever, only chronic throat clearing, a rougher voice in the mornings, and mucus that begins building the moment they open their eyes. Ask yourself honestly, is your throat noticeably worse first thing in the morning compared to later in the day? Does bending forward make it worse? Has your voice sounded different right after waking up? These are the telltale fingerprints of silent reflux, and later in this video, you will get specific, practical steps you can put into action tonight. One more detail worth knowing here. If you regularly take anti-inflammatory medications for joint pain, ibuprofen or naproxen, for example, peer-reviewed research has shown this class of medication weakens the stomach's natural protective lining. That makes acid reflux, including the silent variety we just described, significantly more likely to develop or worsen. If this applies to you and your throat has been bothering you persistently, bring that connection up directly with your doctor. If this is starting to sound familiar, stay with me, because number 2 might explain even more. The second cause tends to arrive quietly, and that is exactly why it so often goes unnoticed for years. When most people picture sinus problems, they imagine the dramatic version: intense facial pressure, a throbbing forehead, a nose completely blocked, the textbook sinus infection. But in many adults over 55, chronic sinus inflammation shows up almost invisibly. Breathing feels mostly normal. There is little to no headache. And yet the sinuses, mildly swollen and producing slightly more mucus than they should, are draining quietly down the back of the throat all day, every day. This is called postnasal drip, and a 2024 study found that the average age of patients presenting with this exact issue is 55. That is not a coincidence. That is your age group almost precisely. Here's the frustrating part. Many people dealing with this have spent months taking over-the-counter antihistamines, assuming the problem must be seasonal allergies. There is a reason that approach tends to disappoint. Antihistamines dry the mucus temporarily, but they do nothing to address the underlying inflammation inside the sinuses driving the excess production in the first place. And dried, thickened mucus stuck at the back of the throat is often more uncomfortable than the original problem ever was. The approach with the strongest research support is simple, affordable, and almost entirely overlooked: regular nasal rinsing with warm saline solution. A 2025 clinical review published in the journal Medicina, surveying evidence across a wide range of sinonasal conditions, concluded that nasal irrigation is a safe, effective, low-cost strategy for both treating and preventing upper respiratory tract issues. It is widely recommended as a supporting treatment by ENT specialists around the world. High-volume saline rinses work by physically flushing out inflammatory mucus, reducing swelling in the nasal tissue, and improving the very ciliary clearance function we discussed earlier, the system that naturally slows with age. The single most important word in all of this is consistency. Using it once or twice gives you 1 or 2 days of mild relief. Daily, correctly applied use produces real, cumulative improvement over time. The exact method is coming up in the action plan. If this is sounding more and more familiar, keep watching, because the next cause surprises almost everyone who hears it for the first time. The third cause is the one that catches people most off guard because it has nothing to do with their throat, their sinuses, or anything they would think to question on their own. It is sitting quietly in their medicine cabinet. There is a class of blood pressure medications called ACE inhibitors, short for angiotensin-converting enzyme inhibitors. They are prescribed millions of times every year. They are effective and generally well tolerated, but they carry a documented class-wide side effect that research describes clearly. They allow a substance called bradykinin to build up in the body, and in a meaningful percentage of people, studies report somewhere between 5 and 20%. That buildup triggers persistent throat irritation and a constant nagging urge to clear the throat. This is not an allergy. It is not anything unusual or wrong with your body. It is simply how the medication functions, and your throat happens to be sensitive to that effect. Here is what makes this connection so easy to miss. The side effect can take weeks, even months, to appear after starting the medication. So if you began taking a blood pressure pill 8 months ago and your throat symptoms started 6 months ago, you may never have connected the two events at all. But that delayed timing is exactly the pattern the research describes. A large-scale study involving more than 27,000 patients found that adults over 65 had 53% higher odds of experiencing this throat-related side effect compared to younger users. That makes this directly relevant to you. If you take a blood pressure medication and are not sure whether it falls into this category, a quick question to your pharmacist will get you an answer in under a minute. And if it does turn out to be an ACE inhibitor, there are alternative medication categories, ARBs, angiotensin receptor blockers, that control blood pressure just as effectively without carrying this specific side effect. That is a conversation worth having with whoever prescribed it. We are halfway through, and this next one is something almost everyone underestimates, not because it is complicated, but because it seems too simple to matter. The fourth cause is hydration, but the way it actually affects your mucus is probably not what you think. Your mucus is mostly water. Whether it stays thin and easy to clear or turns thick, sticky, and stubborn depends directly on how well hydrated the surrounding tissue is. Picture maple syrup fresh from a sealed bottle compared to maple syrup that has been left open on the counter overnight. Same substance, completely different texture and behavior. Your mucus follows that exact same pattern based on your hydration level. Here is the part that makes this more than a generic reminder to drink more water. Research has clearly established that the thirst mechanism becomes significantly less reliable as we age. A younger adult feels thirsty well before any meaningful dehydration sets in. In older adults, that early warning system is blunted, sometimes considerably. You can be dehydrated enough to noticeably thicken your mucus and affect your daily comfort without ever feeling particularly thirsty. That means waiting for thirst to remind you to drink puts you consistently behind. A mild ongoing state of dehydration, maintained day after day without you realizing it, keeps mucus persistently thick and sticky in a way that amplifies every other cause we have already discussed. A practical fluid target referenced widely in clinical nutrition guidance is approximately 30 milliliters per kilogram of body weight per day from all sources combined. Water, herbal teas, soups, and water-rich foods all count toward that number. The key is not catching up after the fact. It is steady, deliberate intake spread across the entire day. Now we get to the cause that almost never gets mentioned in conversations like this one, and it might be the most important piece of the entire picture. The fifth cause is not in your throat, your sinuses, or your stomach. It is in your gut. Here is what the research shows. Your digestive tract and your respiratory system share regulatory pathways through both the immune system and the nervous system. The health of your gut microbiome, the trillions of bacteria living in your intestines, directly influences how reactive and inflamed your upper airways become. When that microbial balance is disrupted, a state researchers call dysbiosis, it can trigger immune responses that promote excess mucus production in the airways. Not because anything is physically wrong with your throat, but because your gut is sending inflammatory signals your respiratory system is responding to. This connection, often referred to as the gut-lung axis, is an active and growing area of clinical research. Studies published in respected respiratory and immunology journals have confirmed that disruption of the gut microbiome can trigger immune responses that promote airway inflammation. Animal studies have pushed this further. When gut microbiome transplants from patients with chronic lung disease were given to mice, those mice showed a measurable increase in airway mucus production, demonstrating a direct causal link between gut health and what happens in your airways. What disrupts the gut microbiome in older adults? A diet low in fiber and fermented foods, repeated courses of antibiotics over the years, high sugar intake, chronic stress. These are not rare or unusual factors. They describe the everyday reality for a large share of adults in this age group. You will not fix a gut airway connection with a throat lozenge, but you can begin supporting your gut microbiome through small, consistent daily choices. And that is exactly what is coming up in the action plan. Before we get there, one moment that genuinely matters. Most of the time, persistent throat mucus in older adults is benign, exactly the kind of manageable, addressable issue we have spent this entire video discussing. But occasionally, your body uses a symptom to flag something that needs professional attention rather than home management. Please make an appointment with your doctor promptly if you notice any of the following: mucus that is tinged with blood, even a small amount, difficulty swallowing that is gradually getting worse, unexplained weight loss alongside your throat symptoms, a lump or persistent swelling anywhere in your neck, a significant voice change that does not improve over time. These signs go beyond what we are covering today. Please do not try to manage them on your own. Bring them straight to your doctor. Now, the action plan. This is where everything we have covered turns into something you can actually start using today. Tonight, stop eating at least 3 full hours before lying down. When you eat and then immediately recline, your stomach is still actively working, and the valve we discussed earlier has its hardest time staying closed. 3 hours of upright time after your last meal is one of the most well-supported behavioral changes for reducing nighttime silent reflux. Elevate the head of your bed slightly, not with extra pillows under your head, which only bends your neck uncomfortably, but with a firm wedge placed under the headboard legs or mattress itself. Even a small incline uses gravity in your favor and meaningfully reduces how much acid can travel toward your throat while you sleep. Before bed tonight, drink a full glass of warm water. This simple habit supports hydration through the night and helps keep mucus thinner, so morning accumulation feels less severe. Tomorrow morning, before coffee, before breakfast, before anything else, drink 1 to 2 glasses of plain warm water. This single habit costs nothing, and it immediately begins rehydrating your body and loosening the overnight buildup of mucus before it has the chance to take over your entire morning. It is consistently one of the most impactful changes people report. This week, pick up a nasal rinsing device from your pharmacy. A neti pot or a squeeze-style bottle works fine. Use water that has been boiled and cooled to a comfortable warm temperature, never straight from the tap. Add a small pinch of plain salt, and if you'd like, a very small pinch of bicarbonate of soda, which may help thin mucus by gently neutralizing nasal acidity. Use it once daily, ideally in the morning. Give it 2 full weeks of consistent use before deciding whether it is helping. Consistency is the entire difference between people who say it worked and people who say it didn't. Schedule an appointment specifically to review your medication list against your throat symptoms. Write down a simple timeline beforehand, when your throat symptoms began and when you last started or changed a medication. Bring that timeline with you. If you take a blood pressure medication, ask directly whether it falls into the ACE inhibitor category and whether an alternative in the ARB class might be a better fit for you. To start supporting the gut-airway connection, add 1 small daily serving of a fermented food to your routine. Plain yogurt with live cultures, kefir, a small portion of kimchi or sauerkraut. These choices help diversify and support your gut microbiome in ways research links to reduced airway inflammation over time. This is not an overnight fix. It is a long-term strategy, and long-term strategies are the ones that actually shift your baseline for good. Set reminders to drink water throughout the day. Keep water accessible in every room you spend time in, and lean on water-rich whole foods like cucumbers, watermelon, soups, and herbal teas. Your mucus will respond within days. A quick word on popular home remedies, because chances are you have tried a few of these already. Honey genuinely soothes irritated throat tissue. It is not harmful and can calm symptoms temporarily, but it does not address any of the 5 causes covered today. Dairy does not create mucus out of nothing. The science does not support that claim. But some people do notice dairy proteins make existing mucus feel thicker. If that sounds familiar, a 2 to 3 week reduction trial is worth trying. Apple cider vinegar is a popular online suggestion, but for anyone dealing with silent reflux, introducing additional acid into the system can actually make the problem worse. Approach that one with real caution. Here is what to walk away with. That persistent coating at the back of your throat has a reason. 5 possible reasons, in fact, and most people living with this have never had even one of them properly explained. Silent reflux, happening quietly, while you sleep, with no heartburn to warn you. Post-nasal drip from low-level chronic sinus inflammation that never announces itself dramatically. Medication-related throat irritation, specifically from ACE inhibitors, surfacing months after starting a prescription and almost never getting connected to the cause. Mild chronic dehydration, sitting just below the level that would normally trigger noticeable thirst. And gut microbiome disruption, sending inflammatory signals your airways are simply responding to. None of these require you to accept a life of constant throat clearing as your new normal. Every single one has a practical, evidence-grounded response, and none of the first steps require a prescription or a specialist visit. They require a bit of knowledge, some consistency, and a willingness to treat the symptom as a message worth listening to, rather than a nuisance to push through. If anyone has ever told you this is simply what getting older looks like, hopefully this gave you a different way to see it. You are not just aging. You are dealing with specific, identifiable, addressable physiology, and you deserve to understand exactly what is happening in your own body. If this gave you something genuinely useful today, share it with one person who has been quietly dealing with the exact same problem. It costs nothing, and it could completely change how they understand what their body has been trying to tell them. And before you go, think about which of these 5 causes surprised you the most, and how long you have actually been dealing with this. That answer matters more than you might think.